Hi, everyone. I'm going to share with you a presentation on the MTV Sugar program, which is implemented by Botswana's National AIDS and Health Promotion Agency and supported by UNICEF. Just sharing with you a little bit of demographic and some stats around how the program got to take place or got to be. We have a population of about 2.2 million, and 30% of that is actually adolescents and young people. And one thing that we are realizing is that a third of new infections in the country is actually amongst adolescents and young people. And also we have a big issue around early and unintended pregnancy and issue around sexual violence. As you can see on box number 5 over there, the prevalence of sexual violence for female and males, there is a big disparity around that. And I think one of the key things to highlight is that knowledge levels are quite high around HIV prevention, but comprehensive knowledge is around 49%, which is quite low. And when you now taking that to the practice of safe sexual behavior, that shows that there is a gap between knowledge and practice. So this program really tries to be a bridge between that. And the program, since its inception, has been focusing on intergenerational and transactional relationships as one of the drivers, condom use, sexual exploitation and abuse, HIV self-testing, and PrEP as one of some of the new innovations around HIV prevention, as well as HIV status disclosure as one of the contributing factors or the drivers for lack of early enrollment into treatment. And we've been using multiple communication channels to drive the program, and radio being the anchor of all these communication channels, followed by social media, interpersonal peer education, virtual peer education, and the interactive voice response. Just zooming in a little bit onto these communication channels. Radio being the anchor, we have been airing the radio drama that is around these issues on 2 youth radio stations that are national within the country, and we have been reaching more than 300,000 young people annually around with radio. And just what you're seeing on your right is results from the end-line survey we did after season 1, just to see how radio is performing and if we are in the right direction. And most of the indicators were showing movement in the right direction. So this is why we've continued with producing season 2 and season 3. The IVR, or the interactive voice response platform that we have, we use this to extend the radio drama such that a young person can just dial a code and be able to listen to the radio drama from their phone. And we also included an innovation around putting in a game that is linked to the radio drama for young people, for them to be able to partake in the decisions that the characters are making, and so that we can zoom into the importance of decision making and how it can change the trajectory of a young person's life. And this platform gets to be accessed by more than 2,000 young people on monthly basis, and 70% of them being girls and young women. So the targeting is really on point here. And we have inbuilt a monitoring system where people have to respond to certain questions within the early episodes and at the end, such that we can see the impact. And this is what you are seeing on the right side there. And just an example, on the last one there is a positive change of 7% in terms of how young people perceive reporting sexual abuse. On the peer education, this one here, we try to expand the program by focusing on the 4 districts that have major issues and implementing a peer education program where our pool of volunteers reach out to young people in schools and within their communities through the peer education manual that we have and through the videos. It's more of an edutainment-based peer education program. And it reaches more than 6,000 young people annually. And also, as you can see on the impact side from the pre and post assessments that we are doing on an annual basis, we are seeing changes. And I can say up to now, we have been seeing cumulative positive change for most of the indicators that we are tracking. And social media, we couldn't leave it out because this is almost where young people actually live. So we use it to extend the radio drama series as well. Every Monday, we post in the episodes on social media so that young people can be able to engage, because it's easier for them to engage on social media more than on any other platform. And we also took advantage of this platform last year at the advent of COVID-19 to partake in a drama series that 5 countries took part in, called the MTV Sugar Alone Together, to try and zoom in on COVID-19 issues and its effects on young people. And it received very great reception from young people. As you can see on your right, it was the most viewed of all the content that we were putting on social media last year. And lastly, in terms of the way forward for the program, we started the program as UNICEF supporting government, and slowly over the years, government has been taking ownership of the program. For example, this year, government put funding for the program. In terms of the first half of the year, the program was funded from the government coffers, and UNICEF is slowly becoming a technical partner within the program, reducing the footprint as government takes this over. And we continue to support government to leverage domestic and external resources for the sustainability of the program. And one of the key highlights is that we recently signed a MOU with a private sector partner who expressed interest on the peer education program. And we will be working with that private sector partner for the next 3 years. Both they providing technical and financial support to the program. And finally, we keep on documenting lessons learned to revise the scale-up plan of the program. That's how we keep it running and making sure that it's impactful and sustainable. Thank you.